Okay, so good morning everyone and good evening to those who are in the US. So today is Monday again in the US and Tuesday for us here in Manila. And every Monday we have our doctor's training call. So for today, we'll be having no other than Dr. Oclarit, who would be discussing all about diabetes. Now, before I pass this to Dr. Oclarit, let me just greet a good morning to of our medical consultants, Dr. Mario and Dr. Arlie. Good morning, doctors.
Good morning, Francis. Good morning, everyone. Good morning, Dr. Oclarit. Thank you for joining us tonight, this afternoon here in our doctor's training. I hope you learn a lot from Dr. Oclarit, as I know I will. Dr. Arlie?
Yes, good evening, America. Good morning, Asia. Our topic is very important because diabetes is among the top 10 causes or cause of mortality. So it's very important that we learn how it happens and how we can prevent it. Francis?
Dr. Arlie, for those who are new in today's call, can you help me introduce our speaker for today?
Yes, it would be a privilege for me to introduce our speaker, who is a part of our medical team. And our speaker, Dr. Jose Oclarit, is a professor in the College of Medicine in Asnar Memorial Medical Center in Cebu. And he teaches two major subjects that all doctors have to pass, and that is physiology and biochemistry. And at the same time, our esteemed lecturer today is a scientist that is well-renowned and recognized here in the Philippines and abroad. In fact, last year, for the information of everyone, he was nominated as one of the possible, let's say, award of Nobel Prize in Chemistry. That was only last year. So he is a nominee, and just to be nominated is already a big way of being recognized in the field of, let's say, research, especially in chemistry. So, ladies and gentlemen, get your notebooks and pen ready, and let us hear from Dr. Jose Oclarit.
So our topic this morning is about diabetes mellitus and what is really diabetes mellitus. Okay, today's topic, we will talk about the introduction, the types of diabetes, signs and symptoms, complications, its pathophysiology, and other complications. Okay, diabetes mellitus is a group of metabolic disorder or metabolic disease which is characterized by high in blood sugar in the blood over a prolonged period of time. So the blood sugar, which is glucose, is abundant in the blood, excessive glucose. The symptoms of high blood sugar include frequent urination. You call it polydipsia, polyuria. Polydipsia is thirst, and polyphagia is always hungry. So person with diabetes is always hungry, is always urinating, and is always thirsty. So those are the three main signs of diabetes. I repeat, polydipsia, thirsty, polyuria, or always urinating, and polyphagia, or always hungry. If diabetes is left untreated, it can cause many complications. It can lead to ketoacidosis, non-ketotic hyperosmolar coma, or even death. Serious long-term complications include heart disease, stroke, chronic kidney failure, foot ulcers, and damage to eyes. So diabetes is due to either the failure of the pancreas, the beta cells to produce insulin, or for the body to unable to respond to insulin. So you call it insulin resistance. Since in endocrinology, there are two there are two things here. The signal molecule. So for the signal molecule, insulin is the signal molecule coming from the pancreas. If insulin is not sufficient, then it will produce what you call diabetes mellitus type 1. And if there is insulin, but it is not recognized, or it resisted, then it is called diabetes type 2. So again, the signal, which is the signal molecule, which is insulin, is not sufficient. That is diabetes type 1. If the insulin is present, but it is not recognized, it is called diabetes type 2 or insulin resistant type. There are three main types of diabetes. Type 1, diabetes mellitus, and type 2, diabetes mellitus. And the third one is known as the gestational diabetes. Gestation means pregnancy. So this particular diabetes occurs when the woman is pregnant. Usually, usually the source of this diabetes is the fetus, the growing fetus. It is some sort of a hormonal deficiency, or it is a problem of the fetal development. So diabetes type 1 results from the pancreas unable to produce enough insulin. So remember that insulin is produced in the beta cells of the islet of Langerhans. If you can see the drawing, it is called islet because it looks like an island, and in the islet there are three major types of cells. The alpha cells that secretes glucagon. When we are hungry, the islet of Langerhans alpha cell will produce glucagon so that the glycogen in the liver and muscles are converted back to sugar in order to restore the sugar level in the body. When our sugar is elevated or abundant, then the beta cells of the islet of Langerhans will release the insulin in order to sequester the sugar in the blood into the liver and muscles. This form was previously referred to as insulin-dependent diabetes mellitus, which is actually known as type 1 diabetes, or sometimes it is also called juvenile diabetes because it has been discovered to be very frequent in children. The cause is unknown, but you see, I think one of the primary causes of diabetes type 1 is autoimmune disease. Autoimmune disease destroys the beta cells of the islet of Langerhans. And diabetes type 2, as I told you earlier, it is called insulin resistant. The person with diabetes type 2 is capable of producing insulin, but the insulin is not recognized by the target cells, such as the liver and muscles and adipose tissues. So insulin, this is also insulin resistance, in which the insulin is not recognized by the target. Condition in which the cell fail to respond to insulin and it does not recognize and it will not transform into physiological function. This form was previously referred to as non-insulin dependent diabetes mellitus, or NIDDM, or it's called an adult onset of diabetes. In the world, 10% of diabetes is type 1 and only 90% is type 2, or majority of the diabetes in the world today is type 2 diabetes. It is ranging from 90 to 95%. So it's in other words, there are majority of diabetes that is reported in the world is type 2 diabetes. The primary cause of this type 2 is excessive body weight and not enough exercise. So it's more of a lifestyle. That's why diabetes is a lifestyle disease. So gestational diabetes occurs. This is the third type of diabetes. The third main form and occurs in the pregnant women without a previous history of diabetes, not necessarily diabetic. So the mother is not yet diabetic until she became pregnant. So it's more likely it is the dictate of the child or the growing fetus. So comparison of type 1 and type 2 diabetes. The feature in type 1, the onset is sudden, but in type 2, the onset is gradual, meaning it is not developed only at one time. So it is actually a lifestyle. Age at onset, mostly in children. That's why it's called juvenile for type 1. And for type 2 is mostly in adults. And the characteristic body size of the type 1 is thin or normal. And in type 2, it is often obese or very fat. Ketoacidosis is common in type 1, but it is rare in type 2. Autoantibodies is actually usually present, meaning this is autoimmune. The cause of type 1 is autoimmune, but it is absent in type 2. Endogenous insulin is low or absent or zero. But in type 2 diabetes, it is present, but only sometimes decreased or sometimes increased. And another is concordance of identical twins. For identical twins, usually 50%. For type 2, it is 90%. So prevalence, the prevalence of type 1 diabetes is 10%, while the prevalence of type 2 diabetes is 90 to 95%. So what are the characteristics? You can see in this drawing, the diabetes, main symptoms of diabetes is polyphagia, or as I said, the person with diabetes is always hungry. The term is polyphagia, and with blurred vision. The second one is it has a weight loss, or the breath. The breath of a person with diabetes smells like acetone. So if you smell acetone, that is the smell of the person with diabetes. Parang acetone. In respiratory, it is breathing, hyperventilation. In the gastric, there is nausea or vomiting, abdominal pain, and in the kidney, it causes the frequent urination, or you call it the polyuria or glycosuria or glucosuria. So frequent urination is an indication of diabetes. Frequent eating or polyphagia, and frequent thirsting is polydipsia. Polydipsia, polyuria or glucosuria, and polyphagia. So those are the main symptoms and signs, indicators of diabetes. So signs and symptoms. The classic symptoms of untreated diabetes are weight loss, polyuria, increase in urination, polydipsia or increase in thirsting, and polyphagia, increased hunger. A symptom may develop rapidly, weeks or months, or in type 1 diabetes, while they usually develop much more slowly and may be subtle or absent in type 2 diabetes. In addition, they also include blurry vision, headache, fatigue, slow healing of wounds, and cuts. It has an itchy skin. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in the vision changes. A number of skin rashes can occur in diabetes, are collectively known as diabetic dermadromes. Diabetic dermadromes. Those are structures that you can see in the skin of a person with diabetes, like there are protruding skin. Complications. All forms of diabetes increase the risk of long-term complications. This typically develop after many years, about 10 to 20 years. The major long-term complications relate to damage of blood vessels, or you call it. So there is a cellulitis or damage in blood vessels, and diabetes doubles the risk of cardiovascular disease, because once the endothelium is damaged, there will be a formation of atherosclerosis or plaques. About 75% of deaths in diabetes are due to coronary complications. So 75% of deaths of diabetes is due to complications in coronary artery disease. Other macrovascular disease include stroke. Stroke or heart attack may also be a characteristic of diabetes. And peripheral vascular diseases. Peripheral peripheral or outer. Complications. Complications, the primary complications of diabetes is due to damage in small blood vessels, include damage to the eyes and kidneys and the nerves. You call it the myopathy. Damage to the eyes known as diabetic retinopathy. So the retina is damaged due to the damage of blood vessels in the retina that are very, very small, caused by the damage of the blood vessels in the retina of the eye, and can result in the gradual vision loss and blindness. So it may lead to blindness. Damage to the kidneys known as diabetic nephropathy can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or kidney. Chronic kidney disease is one of the complications of diabetes for a long-term diabetes. Damage to the nerves of the body known as diabetic neuropathy or myopathy in the most common complications of diabetes. Nephropathy, so the nerves are damaged. Other complications include numbness, tingling of the toes and fingers, pain, altered pain sensation, which can lead to damage to the skin. Diabetes-related foot problems such as diabetic foot ulcers or diabetic wounds may occur and can be difficult to treat, occasionally requiring amputation. So additionally, proximal diabetic neuropathy causes painful muscle wasting and weakness. This is called diabetic amyotrophy. So pathophysiology of the diabetes. The pathophysiology of diabetes includes, since insulin is the principal hormone that regulates the uptake of glucose, excess glucose in the blood is removed from the blood through insulin. Insulin is the principal hormone that regulates the uptake of glucose in the liver. From the blood, it is deposited to the liver and muscles and into the adipose tissues. So insulin acts via the insulin-like growth factor 1. So an insulin-like growth factor 1 or somatomidine, the other term for IGF-1 is somatomidine. Therefore, deficiency of insulin or insensitivity of its receptors plays a central role in all forms of diabetes mellitus. So the receptors are insensitive, and therefore it cannot recognize the insulin. That's why it's called insulin resistant type for type 2 diabetes. That is the pathophysiology of diabetes. Another is the body obtains glucose from three major sources. First, the glucose is absorbed from the blood through the intestine via our food. So the much sugar can be obtained from our food via our intestinal absorption. And the other source is once you are hungry, the glucagon which is released by the alpha cells of the islet of Langerhans will be released and convert glycogen, which is a polysaccharide stored in the liver, is converted into glucose found in the liver. And the other one is gluconeogenesis, or the generation of sugar from non-carbohydrates such as fats and proteins. So when we are hungry, the proteins and fats are converted back to sugar in the process called gluconeogenesis. This happens when we are hungry. That is the influence of glucagon. I repeat, glucagon, secreted by the alpha cells of the islet of Langerhans. Insulin plays a critical role in balancing the glucose levels in the body. It can inhibit the breakdown of glycogen or process of gluconeogenesis. So insulin can inhibit that one. But it can stimulate the transport of glucose from the muscles into the fat tissues and muscles, from the blood into the muscles and fats. It can also stimulate the storage of glucose in the form of glycogen in the liver. in the process called glucose transport into the liver is aided by the glucose transporter known as GLUT4. GLUT4 is an insulin-dependent sugar transporter across the liver of our body. GLUT4. So insulin is released into the blood by the beta cells of the islet of Langerhans and of the pancreas in response to rising levels of blood glucose. So once we eat, just 20 minutes after eating, there is already a rapid release of insulin from the beta cells of the islet of Langerhans in order to sequester excess sugar into the liver and muscles, and furthermore, excess of sugar can be deposited into the adipose tissues or bilbil. Lower glucose levels results in decreased insulin. So lower glucose levels results in decreased insulin release from the beta cells, results in the breakdown of glycogen to glucose. This process is mainly controlled by the hormone called glucagon, which I said is the opposite of insulin. So the opposite of insulin is glucagon. Glucagon is released by the alpha cells of the islet of Langerhans, while insulin is released by the beta cells of the islet of Langerhans. It was found out that white sugar destroys the beta cells of the islet of Langerhans. That's why it is not good to drink soft drinks, because soft drinks are made of the white sugar, and white sugar selectively destroys the beta cells of the islet of Langerhans. So eventually, if you are fond of drinking soft drinks, it will develop into type 1 diabetes. So if the amount of insulin available is insufficient, it will actually cause the elevated levels of sugar in the blood. If cells respond poorly to effect of insulin, in the case of type 2, if insulin itself is defective, then glucose will not be absorbed into the liver and muscles, and therefore it will persist in the blood and it will cause acidosis or ketoacidosis. When the glucose concentration in the blood remains high over time, the kidneys will reach a threshold reabsorption. That's why it's called glycosuria. This increase in osmotic pressure of the urine and causes polyuria and increase the fluid loss, because sugar can attract water. Therefore, it will now increase the urine formation. That's why there is a glucosuria or glycosuria brought about by elevated levels of sugar called osmotic pressure, hyperosmotic condition. The loss of blood volume also will happen because the water in our body is attracted to the sugar, and therefore it will make urine and causes the polyuria and causes dehydration. That's why it also causes what you call the thirsting or polydipsia. So that is a major pathophysiological manifestation of a person with diabetes. You're always thirsty. So type 1 diabetes is characterized by loss of insulin producing beta cells. So the beta cells are destroyed. As I said, one of the factors that cause the destruction of beta cells is the enzyme or the chemical called alloxan. Alloxan is abundant in white sugar. Alloxan destroys the beta cells, and therefore it will develop type 1 diabetes, leading to insufficiency of insulin, and it will lead to diabetes type 1. Immediate future in which that T cell will attack the beta cells and leads to the destruction of the beta cells that leads to type 1 diabetes. So there is a certain case called lupus of the pancreas will lead to type 1 diabetes. So lupus, which is an autoimmune disorder, can also lead to, because lupus can attack anywhere in the body. It can attack the kidney, it can attack the pancreas, and in the pancreas, it will destroy the beta cells. That's why through this autoimmune attack, it will now develop type 1 diabetes. So type 1 diabetes, most affected people are otherwise healthy and healthy weight when onset occurs, but sensitivity and responsiveness to insulin are usually normal, especially in the early stages. Type 1 diabetes can affect children or adults, but was traditionally termed juvenile because it is very common in children. Type 1 diabetes is common in children, but this is only 10% of the occurrence. Type 1 diabetes is partly inherited with multiple genes, including HLA genotypes. So it is genetic, no? It can be inherited, known to influence the risk of diabetes. So diabetes type 1 is involving HLA genes or HLA genotypes. Is genetically susceptible people, the onset of diabetes can be triggered by one or more environmental factors such as viral infection or diet. Among dietary factors are gluten. Gluten may lead to type 1 diabetes, but mechanism is not fully understood. If you are diabetic, do not eat gluten. Type 2 diabetes mellitus is characterized by insulin resistance. This is the case where insulin is not recognized by the target cells, like the liver and muscles. The defective responsiveness of insulins is believed to involve the insulin receptor. So the receptor is damaged. So for people that are obese, normally the receptor are covered with fats. That's why they are normally obese people are type 2 diabetes. In the early stage of type 2, the predominant abnormality is reduced insulin sensitivity. The insulin is not recognized because the receptor are damaged. Type 2 diabetes mellitus is due primarily to lifestyle factors and genetics. So it is type 2 and genetics. A number of lifestyle factors are known to be important for the development of type 2 diabetes includes obesity, lack of physical activity or lack of exercise, poor diet, and stress. Because stress can lead to the release of cortisol, and cortisol can lead to the gluconeogenesis. Once you're a stressful person, a person who is stressful is normally diabetic because once you're stressed, your body releases cortisol in the adrenal gland, and cortisol can elevate the sugar level in the body through what you call gluconeogenesis in the liver and kidney. That's why stress can lead to what you call adrenal diabetes or diabetes due to stress. Dietary factors also influence the risk of developing type 2 diabetes, such as sugar-sweetened drinks like soft drinks, type of fats in the diet. So saturated fats, such as those found in lechon, trans fatty acids increase the risk of diabetes. Polyunsaturated and monosaturated fatty acids decreasing the risk of diabetes. Eating lots of white rice, that's why one of the interventions for diabetes is do not eat rice anymore. Do not eat rice because white rice can lead to increase in sugar level. Lack of physical exercise is believed to consist 7% of the cases involving diabetes type 2. So exercise is very important. And the third type of diabetes, which is gestational diabetes mellitus resembles type 2 diabetes in several aspects. Involves the combination of relatively inadequate insulin and sensitivity. It occurs about 2 to 10% of all pregnancies and may improve or disappear after delivery. So this gestational diabetes may disappear after the baby is delivered. However, after pregnancy, approximately 5 to 10% of women with gestational diabetes are found to have diabetes mellitus, mostly type 2. So gestational diabetes is fully treatable but requires careful medical supervision throughout the pregnancy. Management may include dietary changes, blood glucose monitoring, and in some cases, insulin may be required as a case of intervention. So, though it may be transient, untreated gestational diabetes can damage the health of the growing baby or the mother. The risk to the baby include macrosomia or high birth weight and congenital heart defects, So the baby will develop congenital heart defects and central nervous system abnormalities, skeletal muscle malformations may happen to the children for the mother with gestational diabetes. So nasira yung bata. Increased levels of insulin in fetus blood may inhibit fetal surfactant production and cause therefore respiratory distress syndrome in the children because of that. A high blood bilirubin level may result in red blood cell destruction also in the developing fetus for gestational diabetes. In severe cases, the perinatal death may occur, mostly common as a result of poor placental perfusion due to vascular impairment or destruction of the blood vessels in the placenta. Labor induction may be indicated with decreased placental function. Cesarean section may be performed if there is a marked fetal distress or an increase in risk of injury associated with macrosomia such as shoulder dystocia. There are oral manifestations also of diabetes. No specific oral lesions associated with diabetes. However, there are a number of problems by presence of hyperglycemia. Periodontal disease may happen also in diabetic person. Macroangiopathy alters the antigenic challenge. And altered cell-mediated immune response and impaired neutrophil chemotaxis. Increased in calcium and glucose lead to adequate formation of plaques. Collagen breakdown also will happen as a manifestation. So this is the periodontal changes seen in diabetes mellitus. Other oral manifestations of diabetes include salivary xerostomia is common, but reason is unclear. Tenderness, pain, and bumping sensation of the tongue may cause secondary enlargement of parotid glands with sialosis and increased caries prevalence in adult with diabetes, xerostomia, increase in saliva glucose. So hyperglycemia state shows a positive association with dental caries. So dental caries may happen. So sialosis is actually carious lesions on the teeth with xerostomia. So oral manifestations and complications include reasons are unknown but macrophage metabolism, altered inhibition of phagocytosis and peripheral neuropathy and poor peripheral circulation, immunological deficiency, high sugar medium, decreased production of antibodies, and candidal infection are common, and adding effects with xerostomia are manifestations of diabetic people. Other delayed healing of wounds due to microangiopathy and utilization of protein for energy may retard the repair of tissues, or the utilization of protein due to gluconeogenesis is prevalent. Miscellaneous conditions like pulpitis, generation of vascular neuropathies may affect cranial nerves, facial, drug side effects, lichenoid reaction may be associated with sulfonylurea treatment or due to drugs, and it may develop ulcers. So how do you manage it? To minimize the risk of an intraoperative emergency, clinicians need to consider some issues before initiating dental treatment. So glucose levels must be measured, frequency of hypoglycemic episodes must be measured, medication dosage must be monitored, and consultation is very important. So scheduling of visits, diet, blood glucose monitoring, and prophylactic antibiotics, established infection, preoperative contamination, and major surgery. So during treatment, most complications of diabetes mellitus occur in hypoglycemia episode or hyperglycemia. After treatment, infection control and dietary intake must be monitored. So emergency management, hypoglycemia. In hypoglycemia, you have to take immediately sugar, hunger, weakness, followed by sweating, incoherence, and tachycardia. Results in unconsciousness and hypotension. So you have to treat it with sugar, hypothermia, seizures, and even death. So 15 grams of fast-acting oral high carbohydrate must be given. Measured blood sugar is, monitoring blood sugar is necessary. Loss of consciousness, 25 to 30% of dextrose solution by over 3-minute period, and treatment of glucagon by 1 milligram. Severe hyperglycemia, then prolonged onset, and ketoacidosis may develop with nausea, vomiting, abdominal pain, and acetone odor of breath. The breathing smells acetone. Difficult to different hypoglycemia and hyperglycemia. So hyperglycemia needs medical intervention by insulin treatment. While emergency, you should give glucose. Small amount is unlikely to cause significant harm. So hyperglycemia needs medical intervention due to there should be an immediate insulin administration. Diagnosis can be diagnosed by demonstrating any one of the following. Fasting plasma glucose. If the fasting plasma glucose is 126 milligram per 100 ml of blood, then that is already called diabetes. The plasma glucose is 200 milligrams per deciliter 2 hours after 75 grams of oral glucose is administered. You call this the GTT test. Symptoms of high blood sugar are casual plasma glucose amounting to 200 milligram per 100 ml of blood. Glycated hemoglobin or HbA1c is a measure also of diabetes. So it should be greater than 6.5% is considered as diabetes already. So the OGTT measures the body ability to metabolize glucose, most commonly done to check or for gestational diabetes. The patient is asked to take glucose drink and then is measured before and after at intervals after sugar drinking. For standard OGTT test, you should drink 75 grams of or 100 grams of sugar, and then blood is withdrawn, and then the sugar is measured. Blood samples are drawn for 3 times within the time interval of 1 hour. That is how to test the OGTT. So people without diabetes, fasting blood glucose will now be under 7.8. People with impaired glucose tolerance test is the value is 6 to 7 millimoles or after 2 hours of drinking of sugar. Diabetic levels will now result to over 7 millimolar at 2 hours over 11 millimolars. So the whole diabetes diagnostic criteria so the unit here is after 2 hours of glucose should be 7 to 8, and then glucose fasting should be less than 6.1. Diabetes mellitus will be greater than 11, and glucose fasting is greater than 7. So these are the criteria for diabetic by the World Health Organization. HbA1c, it's actually should be less than 4.2, less than 42 or 6.0, it's the normal, and greater than 6.5 is already considered diabetic for HbA1c. So lifestyle management, good nutrition, regular exercise, diet control to maintain blood pressure, surgery, pancreas transplant or kidney transplant, or weight loss surgery maybe also. So thank you very much and good morning.
Okay, thank you. Yes, thank you very much, Dr. Oclarit. Would you like to add more, Dr. Oclarit?
I failed to mention that our Imorigine is very good for type 2 diabetes. Our Imorigine is good at making new receptors for the new cells, especially in the liver and muscles. For our Imorigine, therefore, can manufacture new receptors for type 2 diabetes. And our Imorigine can also repair the pancreatic cells, especially the islet of Langerhans. So that is the effect of our Imorigine. Thank you and good morning.